A common procedure that patients inquire about is what can be done for, quote, a saggy neck. And there are multiple options to address, quote, a saggy neck. The more less invasive approach, I would say, would be thinking about just doing some liposuction. The next step up from liposuction would be thinking about a neck lift. And the next layer up would be combining a neck lift, let's say, with a facelift. Now, what determines, which procedure to do? So a lot of that depends upon you, the patient, and what findings you're displaying on exam. So normally, liposuctions can be for individuals, let's say 40 and younger. And then once you get past your 40s, that's when you start thinking about doing more of a neck lift. And in my hands, normally the reason why I'm doing a neck lift is mainly because of the muscle. There's a muscle below the skin, and it's called the platysma. And what it does, it has attachments on your clavicle, and then it comes up along the neck, and then it interdigitates into the musculature into the face. And you can see as you age, you start to get some banding here. And it's that banding that over time, as it starts to become more lax and it hangs down, that's the indication to go in with a neck lift, to tighten up that muscle, to make things look more defined. Now, the tricky part is when as you get older, and you start to develop some laxity here, what we call the jowl area, as well as along the jawline. It's in those instances that you have to make a determination as, do you want to do a neck lift or a facelift or a combination of the two? And I can't tell you in this video which one to do. It's just not that black or white, I'd say. There's a lot of overlap. But that's where you got to have a talk with your surgeon or whomever you're speaking with, and find out what the benefits and the pros and cons are of both. But a lot of it just has to do with what you as the patient wants, and then what you're showing on physical exam. I hope this sheds some light on the difference between liposuction, a neck lift, and a facelift. And if you have any questions, feel free to put them in the comments. Otherwise, hope you have a great week.